Parkinson's disease is a neurodegenerative disorder that affects the nervous system, particularly the part of the brain that controls movement. It is characterized by a variety of symptoms, which can vary from person to person and can worsen over time. The primary symptoms of Parkinson's disease are tremors, uncontrollable shaking or tremors, usually in the hands or fingers, but may also affect the arms, legs, or other parts of the body. Bradykinesia, slow movements, including difficulty starting and stopping movements, and a reduced ability to perform repetitive movements. Rigidity, stiffness and inflexibility in the limbs, neck, and trunk, which can make it difficult to move. Postural instability, difficulty maintaining balance and coordination, which can lead to falls. Other symptoms of Parkinson's disease can include micrographia, small, cramped handwriting, loss of sense of smell, sleep disturbances, depression, anxiety, or other mood changes. Cognitive changes, including problems with memory, attention, and decision-making. Speech and swallowing difficulties. It's important to note that not all people with Parkinson's disease will experience all of these symptoms, and some people may experience symptoms that are not listed here. Additionally, the progression of Parkinson's disease can vary widely from person to person. Parkinson's disease is a chronic condition, and there is currently no known cure. However, there are a variety of treatments available that can help manage the symptoms and improve quality of life for people with the disease. The main types of treatment for Parkinson's disease are medications. There are several classes of medications that can be used to treat the symptoms of Parkinson's disease, including dopamine agonists, levodopa, and MAO-B inhibitors. These medications work by increasing the levels of dopamine in the brain, which can help improve movement and reduce tremors and stiffness. Deep brain stimulation, DBS. DBS is a surgical procedure that involves implanting electrodes in the brain and using them to deliver electrical impulses to specific areas of the brain. This can help improve motor symptoms, reduce tremors, and improve quality of life. Physical therapy. Physical therapy can help improve mobility, balance, and coordination in people with Parkinson's disease. Exercises that focus on flexibility, strength, and range of motion can also help reduce stiffness and improve movement. Occupational therapy. Occupational therapy can help people with Parkinson's disease maintain independence and perform daily activities more easily. This may involve adapting the home environment, using assistive devices, and developing strategies to conserve energy and manage fatigue. Speech therapy. Speech therapy can help improve speech and swallowing difficulties that can occur in people with Parkinson's disease. This may involve exercises to strengthen the muscles used for speech and swallowing, as well as strategies to improve communication and reduce the risk of aspiration. The treatment plan for Parkinson's disease will vary depending on the individual and the severity of their symptoms. A neurologist or movement disorder specialist can work with the person to develop a personalized treatment plan that takes into account their unique needs and goals. Diagnosing Parkinson's disease can be challenging, as there is no single test or symptom that can definitively diagnose the disease. Instead, doctors typically make a diagnosis based on a combination of clinical observation, medical history, and physical examination. To diagnose Parkinson's disease, a doctor will typically take a detailed medical history. The doctor will ask about the person's symptoms, how they have progressed over time, and any family history of Parkinson's disease. Perform a physical examination. The doctor will perform a neurological exam to look for signs of tremors, rigidity, and bradykinesia, slowness of movement. They may also check for other symptoms, such as changes in posture, gait, or balance. Rule out other conditions. The doctor may order blood tests, brain imaging studies, such as MRI or CT scans, or other tests to rule out other conditions that can cause similar symptoms. Evaluate response to medication. If the doctor suspects Parkinson's disease, they may prescribe a medication such as levodopa or a dopamine agonist to see if the person's symptoms improve. A positive response to medication can help confirm the diagnosis of Parkinson's disease. In some cases, the doctor may refer the person to a neurologist or movement disorder specialist for further evaluation and treatment. It's important to note that Parkinson's disease can be difficult to diagnose, especially in the early stages when symptoms may be mild or vague. A diagnosis of Parkinson's disease should always be made by a trained medical professional who specializes in movement disorders. Unfortunately, there is currently no known way to prevent Parkinson's disease. The disease is caused by a combination of genetic and environmental factors, and the exact causes are not fully understood. However, there are some lifestyle factors that may reduce the risk of developing Parkinson's disease or delay its onset. Exercise regularly. Regular exercise has been shown to reduce the risk of Parkinson's disease, and may also help slow the progression of the disease in people who have already been diagnosed. Maintain a healthy diet. Eating a diet rich in fruits, vegetables, whole grains, and lean protein may help reduce the risk of Parkinson's disease. Avoid environmental toxins. Exposure to certain environmental toxins, such as pesticides and herbicides, has been linked to an increased risk of Parkinson's disease. Minimizing exposure to these toxins may help reduce the risk. Protect the head from injury. Head injuries have been linked to an increased risk of Parkinson's disease. Wearing protective gear during sports and other high-risk activities may help reduce the risk. It's important to note that while these lifestyle factors may reduce the risk of Parkinson's disease, they do not guarantee prevention. Additionally, some people may develop Parkinson's disease despite following a healthy lifestyle. If you are concerned about your risk of developing Parkinson's disease, talk to your doctor about steps you can take to reduce your risk.